Hi friends, Dr. Nancy Trimbley here, putting the power and knowledge of your health back in your hands. Today we're talking about hip pain. Now, I'm going to tell you, when people come in and say their hip hurts, we have to say point to it, because when people talk about their hip, there's a few different places. It could be the actual ball and socket joint, which is actually in the front of your pelvis. It's very deep in the pelvis, and it's more towards the front than you would actually think. Sometimes people talk about their hip crest, which is actually the pelvis. It's the iliac crest. So they might be pointing to the side of their body on the hip. And then there's also, they point to their back, which is really the sacroiliac joint. It's not the hip at all. Or they might be pointing to the side of their leg, actually, which, we all call the hip. So it can be confusing. A lot of times people will say, oh my goodness, I don't want a hip replacement. My hip hurts, I don't want a hip replacement. And they're pointing to a structure in their body that has really nothing to do with their ball and socket joint. But they panic. I mean, we tend to do that. We tend to go right to fear mode and oh my goodness mode. But let's all calm down a little bit, because there's a lot that chiropractic and chiropractic adjustments can do for the hip. For instance, the ball and socket joint, it can actually be out of alignment. It can be forward in the socket. It can be too far backward in the socket. It can be jammed upward in the socket. So there's simple adjustments that can be done on the ball and socket joint to alleviate hip pain, get those hips back in alignment, which will not only help your walking, it'll also help your posture. The other thing is there are a lot of muscles that work this large joint in our body: the hip flexor muscles, the glute muscles, the muscles of the thigh, which would be hamstrings, quadriceps, and the tensor fasciae lata, or the IT band. There's a lot going on there with the pelvis and the hip. So sometimes those muscles are creating problems that is causing you to feel hip pain, and it really has nothing to do with the hip joint. The other thing that can happen is your lower back, the nerves from the lumbar, the sacroiliac joint, those nerves come out and go into not only the hip joint itself, but of course the sacroiliac joint, of course the pelvis, and the front of the pelvis, including the groin area, including reproductive organs. You can have pain in those areas if the nerves of your lower back are pinched or irritated. Going back to relate it specifically to the hip, there are nerves that cross directly across the hip joint, and it feels like it's your hip, and it's not your hip at all. So really what I'm saying is, the hip is bothering you. Yes, chiropractic can help a lot. The chances that you need a hip replacement are probably slim, although they're doing great things with hip replacement surgeries now. They really are. Have your chiropractor sort it out for you. See somebody that specializes or does a lot of work in what is called extremities or extra spinal adjustments. Like me at Trimbley Chiropractic, I do a lot of work in that. And ask the right questions. Make sure you're indicating exactly where you're feeling the problem and when that problem hurts you. Now, if you are looking at a hip replacement, there's a great book out there called An American Sickness by Elizabeth Rosenthal, and she has a chapter that's dedicated to implant devices. That means the actual hip, what hardware they put to replace your hip. It's very enlightening. Please check that out, or pass that information along to anybody you know that is looking at a replacement. Be sure to subscribe to these videos. We do new ones all the time. It's free to subscribe. Hit that notification bell. And as always, putting the power and knowledge of your health back in your hands. Bye for now.